Welcome to our Insights series on organizational well-being. Our question for this week is, Wellness Big Ten, what are the main program intervention options for back pain prevention? Number 26. In answering the question, what are the main program intervention options for back pain prevention for working populations, we are going to be using the same continuum that we talked about in previous week's answers, and that is that the cost, the difficulty, and the effectiveness all go up as we go down the list. So starting with the first one, we can provide messaging in a variety of different ways to employees about the value and benefits of preventing back pain. According to the National Health Survey, approximately 75% of working adults in the U.S. have a back pain event within every 2-year period. So we have a fair amount of morbidity going on in virtually all working populations. We can also distribute to employees educational materials on the basics of back pain prevention, which we're going to go into. And we can encourage employees and spouses to seek out back pain prevention tips themselves and resources by using online resources and other sources of health plans and provider groups that have these kinds of materials available. We can also encourage health and healthcare literacy about back pain prevention and back care in general. So we can talk about the issue of back pain prevention, but we also want to be talking about how does one take good care of their back throughout their lifespan. We can also take steps to strengthen back pain prevention and back care cultural norms across our organization. We can also have employees search their smartphone app store for the term back pain prevention and examine what kinds of apps are available. We can have a group of employees also do this and then recommend what back care apps can be used by the population and or websites that might be useful, and then recommend those specific options to the work group involved. We can also provide the best back pain prevention and back care smartphone app and or books or resources to employees and spouses and promote their use. Another option, and again, remember as we go down the list, the cost gets higher to do each of these interventions, but then the difficulty and requirements of doing them usually take more time and more energy and effort and skill, but their effectiveness is also likely to increase. So we can provide access on the company intranet and computer system to provide a back pain prevention and back care software app that can be used by all the employees. We can also provide a lunch and learn session on back pain prevention and back care tips for employees, particularly newer findings from various research groups. Another thing we can do is to provide a learning management system module on back pain prevention and back care with a quiz. That's what a learning management system does, is it allows us to see and experience and view an educational session. It then has a quiz that you have to pass in order to get credit for having completed that educational module. And then the system keeps track of who's done it and who has not. So this can be linked to your wellness incentive if you're using any kind of a premium reduction or any kind of a plan access, health plan access incentive. So there are a variety of different incentive linkages that you can do. We can also provide a group of those learning management system modules on back pain prevention and associated areas, corollary areas of fitness and exercise and flexibility and things that can be done to improve your back health. And you can also link that with quizzes and or the completion of those can be and correct answers on those can in fact be used in a wellness incentive approach. Another potential intervention option would be to provide a telehealth option for employees so that they can call and talk to a health professional that is knowledgeable about back care tips and back care practices. And they can experience this when they are actually in a back care event or a back pain event, and or their spouse is in such a situation. Another option or alternative is to provide an e-health portal with a strong back care and back pain prevention capability. Another option would be to require completion of one or more LMS modules on back pain and back care and then connect it to a more generous health plan option. And you can also provide a consultation opportunity with a physical therapist with good grounding in back pain and back care issues, and then be able to have that accessible to people that are post-acute condition, but in a situation where they're motivated to take better care of their back and back pain. And finally, you can provide wellness coaches to work with employees and spouses on their back pain prevention and back care techniques. So in summary, there are many ways to improve the back pain experience and lower that back pain experience within groups of employees and their family members, and particularly spouses. Each of these intervention options have their own pattern of direct cost, of difficulty in terms of intervention, carrying out the intervention, and effectiveness. It's also a good idea to consider addressing all the major techniques and options for back pain prevention and sound back care practices somewhere in your employee wellness program. It's best also if you link that to your health plan coverage, particularly the coverage which involves low back pain, treatment, diagnosis, and prevention. Now, for more information on this topic, try putting the following search strings into your web browser: back pain prevention, back care for employees, back pain prevention in the workplace, and good back care techniques. Next week, we'll address the question, Wellness Big Ten, what are the main program intervention options for financial wellness? For more information, please feel free to visit our website at www.chapmaninstitute.com.